Hello, this is Dr. Gary Bellman. I saw a patient recently, which is typical of many men that I see. This was a 55-year-old male who came in with erectile dysfunction, and his basic question was, why do I have erectile dysfunction? I eat right, I exercise, I've taken care of myself, I don't smoke, I don't drink. Why do I have erectile dysfunction? I will often discuss psychological factors with men. He's married, doesn't watch pornography, doesn't feel there's significant psychological factors. I will explain to men that erectile dysfunction can be associated with low testosterone, and we check the testosterone. In his case, the testosterone was in fact normal. I tell men that there can be a risk for cardiovascular disease with erectile dysfunction. He saw a cardiologist and his heart and all his other parameters are normal. So his basic question is, why do I have erectile dysfunction? And basically, there aren't any really good answers to that question, which can be frustrating both for the individual and for the physician. I will tell men that 50% of his peers have erectile dysfunction. Most men don't talk to each other. Women do a better job of communicating with each other about it. Men don't often discuss with their friends if they're having erectile dysfunction. I will tell men that there are certainly good solutions, but basically as far as the cause, I'll explain to men that an erection is where the chambers of the penis fill with blood and gets trapped there. Basically the only part of the body where blood goes and gets trapped. And many men either don't have enough blood flow, don't get firm enough, or many men, the trapping mechanism doesn't work, namely the erection doesn't maintain. And why this happens is, as I see it, basically the body doesn't look at the penis as a huge priority. It will shunt blood preferentially to our internal organs. He and I may disagree on how important the penis is, but unfortunately blood preferentially will get shunted to the kidneys and the spleen and the liver, even though we may disagree. And the body can look at the penis as an appendage like fingers and toes, and you take a walk at night and it's cold, your fingers and toes get cold. So basically, we don't exactly have perfect answers to why men get erectile dysfunction except for age. We do check for testosterone issues, psychological factors, cardiovascular issues, lipid issues. But many men, the question of why we have ED, the answer is unfortunately satisfying, especially to men who have taken good care of themselves, except the only answer is aging. And then once we get through this discussion, then we talk about different treatment options. And fortunately, there are many. Thank you very much, Dr. Bellman.